think it's worth mentioning, maybe Anne, you can pitch in a little bit about pediatrics, because from what I understand from the Secure IBD registry, almost all the children who got COVID were on immunosuppressive medications or biologics. Can you speak to, is all immunosuppression created equal? How are the children doing?
Sure. So that's the question certainly that all our patients and their families are asking. You've seen the data from Gil Kaplan that COVID-19 illness seems to be very rare in children and teenagers anyway. So the Canadian data that Gil showed, 4% of COVID-19 illness so far has occurred in people 19 years of age and younger. So the acquisition of COVID-19 illness seems uncommon in our young patients. Now, and we don't really know why that is. Is it that they're less likely to acquire the virus, or in fact, do they acquire it but just have such a mild illness that no one really knows that it's there? We don't know that. But the question still is, if you're a young person and you're on one of these immune suppressant drugs, and I will say that in Canada right now, the most commonly used agents for children and teenagers with IBD are the anti-TNF drugs, either Remicade, Renflexis, or Humira. So it's very common for young patients with IBD to be receiving these drugs, and moreover, to actually be feeling very well on them and with their IBD well controlled. So are they more at risk either for acquiring the illness or for having something other than a mild illness if they do get it? When we've prepared our guidance, you've seen that we declared moderate risk for anyone under 65 who was on one of these drugs. And it certainly is wise to be careful. And I think we could not say that a teenager of, let's say, 14, whose Crohn's disease is very well controlled on Humira, I think we could not say that he has no additional risk. I don't think we could say that, but you do have to think, just because of the strong age-related factors, that the risk to him is less than that of a 60-year-old who is getting the same medication. We in pediatrics, just as is happening with the Secure IBD registry, so we as pediatricians can participate in that, but there has also been an effort in Europe to register the occurrences of COVID-19 in children and teenagers with IBD. And you're right, Eric, that the ones that are recorded in mostly Europe so far, and it's not very numerous, I think at last record it is only 8. Now they are, I think, all on an immune suppressant drug, but on the other hand, we know that most children and teenagers who have IBD are receiving either a biologic or possibly, especially in Europe, a thiopurine alone without a biologic. So it would be a smaller proportion of children who have IBD who are just on 5-ASA, let's say. And so I think if COVID illness does occur, it's more than likely going to occur in the people who are on the immune modulator, because that's what's common, biologics or immune modulator. But the good news so far is that the illness seems to be mild, and we do think that by virtue of their young age and their good general health, good disease control, that that group of patients should be at lower risk than the older adults.